Hi. Hey everyone. My name is Tamar for those that don't know me, and I am a doula, a birth worker. I do lactation. I help moms and support them during their pregnancy journey. So I just wanted to come up here because I posted something that I think is really important that we need to talk about more. And when you just find out you're pregnant, you want to discuss from things like, oh my God, I'm pregnant, thinking about the baby shower, I'm nauseous. Like a lot of those things come to our heads first. Um, and, the next thing that comes to our head is, oh, I got to get a doctor, or let me make an appointment with my GYN, to confirm the pregnancy and things like that. And we don't take enough time to finding the right provider, if that makes sense, right? We need to spend more time getting to know our providers, getting to know that midwife or the OBGYN, and asking them a million questions, and choosing whether or not we want to work with them, because at the end of the day, we don't work for them, they work for us. Whether we're directly paying them or our insurance is paying them, we're still the ones paying them. And it's a privilege for them to get to work with us on this journey to becoming a mother, or whether it's the first time or the third time or whatever time. um we want to make sure that who we choose to really be the team leader in when it comes down to labor and delivery, it's really, really important. It really makes or breaks the experience. At least that's what I think. So I had posted, I don't really remember what I said, but don't be afraid to choose your provider, and don't be afraid to unchoose your provider. So if you're at a place where this provider, you're just not vibing with them, and you're like 24 weeks pregnant and 26 weeks and 30 weeks, don't be afraid to leave. um, don't be afraid to be like, okay, can I have my medical records? I want to go look for another provider. um, it's better, easier, it's easier said than done, the later and later you get into your pregnancy. But that's why I want to have the conversation now, before you're pregnant, or while you're 4 weeks pregnant or 6 weeks pregnant and you just found out, and you're like, what do I do? Well, I feel like there's a few questions that are necessary to ask um, your providers when you're going to interview them. And yes, I use the word interview because it's a job. You're hiring them for a position, and it's important that they pass the interview and make it to the next round. Um, so, one of the questions I put up today on my Instagram is, what are your feelings about a natural birth? Yes. Some of us may not want natural births. Some of us may very well be okay with having, a medicated birth. But I like that question because it puts them on the spot. It puts and it opens the door for conversation. It's not a yes or no question. It's not, there's not like no cookie cutter answer for it. They really have to answer the question. And depending on what their answers are, will help you better see if this provider is the right one for you. And I'm all for midwives, but if you want an OBGYN, go ahead. If the midwife is not answering these questions to the best of to what you're looking for, then move on to the next. The next question is, will you be at my birth, or will another provider be present? And if so, who will that be? So a lot of the providers that we go to work in practices, and there's about 4 or 6 providers. Like some have like four OBGYNs and then like 2 midwives, or the other way around, or whatever the situation is. Or they work for a hospital that you want to deliver at, or they don't. They're only there 2 days a week. And it's like there's a lot of stipulations to, a question like that. So you want to make sure that you get a clear answer, a concise answer. And if they won't be the providers at your birth, will there be enough time during your prenatal appointments for you to meet or make outside appointments to meet with these other providers? Because the prenatals is one thing, but when it comes to laboring and someone catching your baby, you would have liked to see them before that day comes, and understanding their values and what's important to them, and hopefully it matches with what's important to you. And there's like a million other questions that you could ask, and but I think getting to know your providers and them spending time answering your questions, that they're doula friendly, that they're okay with you asking them all these things, and they're not trying to like shut you down or like shoo you away. That's all very, very important. And if this is going to be your birth, it's important that this is one of the very first steps that you take. And it's truly important. Once you choose your provider, it really sets you up for success. And me being a birth worker, sometimes it's not easy working with doctors and midwives that aren't so doula friendly. It's hard to do our work when the medical team isn't really like welcoming or like care about the doula's presence. And if they have something to say about us as birth workers, then maybe they aren't the right providers for you either, So that was my spiel. So I hope you go ahead and choose the right provider. If you have any more questions, feel free to DM me or email me at info@theheavenlynature.com. Bye.